Hi, I'm Dr. Peters with Peters Wellness Chiropractic and Massage. This week's quick video, I want to discuss headaches. Headaches are so common in our society. Of course, there's many different reasons for this. It could be from dietary issues to emotional stress. It could also be due to some structural issues. And well, based on the x-ray behind me, I think you can tell I'm going to focus on the structural issues. I mean, people, you can cut out sugar, you can control the amount of bad foods that go into you so that you can reduce the inflammation in your body that way. But looking at the structure and looking at the curvature of the spine. So this picture behind me and looking at it, you can see the cervical spine, and there should be what's called a lordotic curvature. That lordotic curvature is what allows the spinal cord to be in its proper position and not be under too much tension. Think of like a rubber band running through, and if you pull that rubber band tight, if you have a reversal of the cervical curve, it can put way too much pressure on the cord. It also puts pressure on the discs, and it puts pressure on the spinal joints, which can cause early decay and the terms osteoarthritis, degenerative joint disease, degenerative disc disease. So really looking at the curvature of the neck and making sure that it is properly aligned. And what we do in our office is manual adjustments. With those of you who come in know that. I also use instrumentation, but I like the manual adjusting better unless someone is in so much pain where you don't have much of a choice but to use some lighter instrumentation in the beginning. So we also, what we'll do is we'll measure the patient's spine and then recommend some home traction. Simple device, you lay down on the floor or a firm surface and you lay on the device and allow that curvature to restore. Now this isn't an overnight thing. Getting the person out of pain, getting headaches under control most of the time is not a real difficult task. What can be difficult is that long-term response, the long-term. So in a year's follow-up, they're still like, hey, my headaches have reduced a lot. I'm feeling so much better. And by doing some home care, putting that responsibility back on the patient. Again, auto accidents and things like that, wrestling injuries, football injuries, cheerleading injuries, and all these different things that a patient says, hey, my daughter's only 16. What age can they start being adjusted? And, the idea of why, I told them, I said, I adjusted my little ones shortly after they came out of mom. I was ready. I want to make sure my kids were feeling healthy and happy, and I don't want them suffering from headaches and all these other things. So helping restore the curvature. Well, most people don't even know what the curvature of their spine looks like. So we like to get x-rays of people coming in. We give them the radiology reports. And then we go over what their spine looks like now, what normal looks like. I just put them up side by side on the screen, and then just getting people to get them out of pain and then help them restore that curvature so that it's a longer lasting effect. So if you suffer from headaches or someone you know or love, someone you work with, please have them see a chiropractor, have them get some x-rays, and help restore that curvature so that we can reduce that pressure and help live a life of happiness, joy, and gratitude instead of pain and suffering and medication. All right, have a great week.